This is Chase Gonzalez. Chase is 8 years old, and he has been diabetic since he was 2. So almost 7 years. Chase is going to show you how to check your blood sugar. Okay, go ahead, buddy. Tell him what you're doing.
Popping my test strips open. Maybe.
Okay, show me what that is. That is an Accu-Check blood sugar test strip, or blood glucose test strip.
I really
That's
like
what is in this box right here.
And put it in my meter.
Mm-hmm. And now what does it show?
Apply drop.
Okay.
I take this,
And what is that?
my poker, or
It's a Lancet. Yep, let's get that right there. That's the Accu-Check Lancet. Okay. And that's what this cartridge is for.
then
That comes in this box. Okay.
So then I take this back piece, top,
Okay.
and put it strong, which is all
There
over
you
my
go.
hand.
Uh-huh.
And I use that. It does that.
Okay. Let me see that. And Chase's blood sugar is ridiculously high. Chase, do you think you have something on your fingers, buddy?
Blood.
Other than blood? No?
Should I go wash them?
Well, we can do that in a minute. We'll retest here in just a second. But what Chase has here is a month's worth of supplies. These are what he's holding there is his 2 different types of insulin. Hold up the blue one first. This is his stabilizer insulin, which is his long-acting insulin, and inside that, this is the insulin is in that inside of it right there. And you turn it up with that dial at the back. That's right. And he gets that shot twice a day. And then this is his quick-acting insulin, and this one has removable cartridges, which are right here. Now, dial that back down to 0, and then push it in, and let me see the back of it. This shows how long it has been since Chase had any insulin, which is a long time, and it shows his how many units he had, and it shows that it's been 6 hours since he had 3 units. Okay, and Chase would dial this up to give himself a shot, which we're going to go ahead and do because Chase obviously needs a shot. So he would use this, which is the pen tip that goes on the tip of his insulin. And that's what's in these. These are ultra fine pen needles. They are nano. And that just goes on there, and he twists it on.
I don't know if I'm doing it right.
You're doing great, buddy. Okay. And then each needle needs to be primed, so he would pull the green cap off first.
Pop.
He would dial up 2 units. This one clicks in half units. So he would do 4 clicks. And then spray that on the table so they can see how much insulin that is. This is 2 units of insulin. That's all insulin right there, but that primes the needle so that he gets all of it. But that's 2 units of insulin. Each cartridge or each pen, this holds cartridges, which are small, disposable. The green or the blue pen, this whole thing throws away. The red pen, we would unscrew it and just the insulin cartridge would come out. Okay, buddy, I want you to go ahead and dial up 6 units.
Whoa.
Hold on, go ahead and do 8 units. So Chase is going to do 8 units because his correction factor is, it brings him down 55 points for 1 unit of insulin. So we're going to try to bring Chase down to a regular level. So at 8 units, it would bring him down, how many points? 400 points? Yeah, bring him down just over 400 points. Let me get at a better angle. There you go, go ahead. He will push that into his skin, depress the plunger, and now count.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Pull it out. There you go. Good job, buddy.
Take this little green piece.
And carefully put it back on. That recaps it for safety so that nobody gets stuck with it.
And we're done.
And we're done. And now Chase has done his diabetes regimen for the
And
next
this
2
is the
hours.
needle.
That's the what goes in your Lancet. What goes in your poker. Yep. Now all of the products that you see here, this is 1 month's worth of supplies. This is around cash value if we were to pay out of pocket for everything without insurance, not counting the tester. This is about $2,500 sitting on our kitchen table. These are the syringes that we use in case we run out of pen tips. We have a small baggie of syringes in case we run out. Yeah, you can take it apart. Go ahead, open it up.
is what it looks like.
And this needle is a little bit longer than the needle you saw on his pen. See, that's
Oh,
here.
wait.
Here,
Let's
let's
just
put them side by side. Take that green one off.
Oh, okay. I
Okay.
don't know. No.
It's okay. Careful. Okay. Now you can see. Let me put them. There you go. You can see the difference in the two. Here, I need you to lay that on the table for me, buddy, so you can actually see it. There you go. You can see the difference in the two needles. Obviously, the smaller one is preferred, but when we run out of those, because we only get so many a month, we have to move to the big one. And now, in case Chase's blood sugar were to drop too low, but we don't need to give you that one. You only get you. Oh, it's okay. It's the same as this one, baby.
This is wrong.
No, honey, it's the same. No, Chase, please stop. Okay. And then the last thing that Chase has, can you open that up for me? This is called a glucagon kit. This is in case Chase passes out
Which way?
and his blood sugar gets too low. Yep, push him just like that. Nope, other way. There you go, baby. Okay, this is if his blood sugar gets too low and he passes out. This is a life-saving kit. Inside of here, don't actually use it, okay? That's the big needle. You can see how much larger that one is. This inside of here is no, we're not actually gonna do it. Is a saline solution. And inside of here is it's a type of hormone that would force his liver, turn it around so we can see the glass. There you go. Is a dried solution of hormone that would force his liver to dump the sugars that it has stored. So he would get this when he's passed out. Within about 15, somebody would inject this saline into the sugar, shake it up, and then give Chase, the big shot. Chase would regain consciousness in about 5 to 15 minutes, and usually it induces vomiting because it's a strong hormone. So, Chase, you're done with your diabetes regimen for the next 2 hours. We'll come poke you and see if you need more insulin, and we'll go from there.
Okay.
Thank you, buddy, for being my guinea pig.
You're welcome.